So when you're told you're not good enough, you tell them, not only am I good enough, I'm more than enough.
Good evening and welcome to the second segment of ProfessionXplore. As you can see, I'm not alone. I'm here with a beautiful lady, which you're about to know about shortly. And my name is Luthando, also known as Luthando. And on our second segment, we have Annelize Chambers. I'm not going to say much about her. I'm going to read her bio, but not only that, she will give us a background, a whole rundown of what she's all about. And just a reminder, and for those who are joining us for the first time, so ProfessionXplore takes place on the first quarter of the year, and that is specifically because we are targeting these three categories of people: high scholars who are yet going to go to varsity, wondering what course should they take, and we want to really, shy away or rather explore further than the traditional mainstream type of courses, your law, social worker, policeman, and etc. All those professions our parents wanted us to take. But also we want to speak to professionals who have been in the corporate world for years and wanting something new, wanting to venture into other fields, or even business people who are wanting to either to scale up their business or try other avenues within the entrepreneurship space. So today I'm going to allow our guests to greet you, and we'll take it from there and see how it goes. Good evening.
Good evening, everybody. My name is Annelize Chambers, and it's such a privilege to speak to Luthando and to be invited to this evening.
Wonderful. Yes. You look stunning, by the way.
Thank you.
Thank you so much for honoring this invitation. And I know we're going to have a wonderful time. You are expectant. I am expectant. And thank you once again for joining us last week on our segment on education. I hope you learned a thing or two. And here's another opportunity for you to learn. So I'll go straight to her bio, and then we'll take it from there. Are you excited? Because I am. Okay, so from the world of communication to the art of healthcare management, Annelize Chambers has built a career defined by adaptability, leadership, and a passion for supporting others. Graduating as a speech and language therapist in 2004 from Stellenbosch University, South Africa, Annelize embarked on a journey of helping individuals find their voices, both figuratively and literally, of course. So she applied her skills at hospitals, NGOs, clinics, and schools across Africa, gaining invaluable experience in both public and private sectors. Her career took her to the UK for 5 years. I can't wait to hear about that, where she broadened her expertise, focusing on special educational needs, that too as well, early intervention and complex swallowing difficulties arising from neurological conditions such as traumatic brain injuries, strokes, genetic disorders, and cerebral palsy. In 2022, after 18 years, guys, 18 years in the speech therapy industry, you would think that was all. Annelize pivoted her career to healthcare management, joining the Dermatology and Skin Career Institute, initially stepping in as a receptionist to cover maternity leave. Look at the journey unfolding, guys. She quickly became an integral part of the practice growth story in just 3 years. The Stellenbosch-based practice expanded from a 2-person team to a thriving operation with 8 staff members and a second branch in Somerset West. Now, as a practice manager, Annelize is the engine behind. Did you hear that? Engine. How do you get to be an engine? I can't wait to hear about that. Behind the Institute's excellence, I love excellence, with a leadership style rooted in servant leadership, she fosters an environment where her team can shine. She's not just about managing processes, she's about empowering people, and you're about to be empowered tonight, cultivating strong relationships and ensuring every patient interaction reflects the Institute's commitment to the core. Annelize's journey is a testament of the power of resilience, adaptability, and the drive to make a meaningful impact wherever you go. Whether supporting children in finding their voice or mentoring staff to excel in their roles, she's a woman who proves that true leadership is about lifting others up. That just reminded me of Professor Mohale's book, Lift As You Rise. Do we even need to continue with this interview? Her bio has said it all, but we want to hear more from her. This is you, my lady, but we want to know, who is Annelize Chambers? Tell us a bit about your upbringing, your school years, primary, high school, even varsity, and then your traveling.
Okay. Sure. Luthando, I was born in Pretoria, but my parents lived in a small little town in northern Transvaal. It's called Annelize. I think it's got a new wonderful name, Lepalale or something today. I'm not sure about the pronunciation, but it was wonderful growing up there because it wasn't a time where you can still cycle to school and walk to school. So we grew up quite independently as children and having to creatively overcome challenges in life and also attend a lot of sport activities at school. We were encouraged from the young age to take part in everything at school, and that also kept us quite busy. So we went out of the house early morning and only came back home late at night. So different to what we have today. So I'm very lucky to have grown up in that sort of independent and safe environment in a small town. Then I studied at the University of Stellenbosch. I was also in school in Pretoria. I was in high school there, High School Elderain. Very proud of my high school. And then I decided to study in Cape Town at Stellenbosch University. I was also alone for 4 years at university. My parents literally dropped me off, and I was in residence, and I had to just cope with a 4-year university degree. And I loved it, but it was also very challenging, not coming home over weekends and just having to survive that 4 years. So I think from an early childhood, I could develop resilience. And I think if I look back, one of the main things that stood out for me is using your creativity and being adaptable in every single environment you find yourself. You have to meet new people, and if you just not go out there and challenge yourself, you're just going to stay behind. And then, yes, after graduating, I worked in the community, and then soon after got married with my husband, Rickard, and we went overseas to the UK, and quickly climbed the ladder there in terms of challenging ourselves to learn as much as we can whilst working in the UK. And then it was a wonderful learning opportunity. Again, a new country, new culture, new people, different languages, different style of working. So it was such a learning curve, those 5 years in the UK, and it prepared us well for coming back again to South Africa and starting all over, both of us. Unfortunately, in South Africa, and as a speech therapist, you have to either work in the Department of Health sector or in the private sector, and there's only a few and far between positions available in the public sector. So people tend to stick in their roles for quite a long time. But nevertheless, it was a journey, and I'm looking back with lots of fond memories of what I was exposed to, again, in terms of adaptability.
Correct.
Yes.
Tell me, why speech therapy?
So speech therapy, I was always interested in the medical field. It was so interesting. One of my favorite subjects at school was biology. So I knew I was going to do something in that field. But also I've got a great empathy for people. I want to help people. There's always been a sort of servant, helping, empathy type of passion in my heart, and to change people for the better. To look at their situation, work alongside them, and change them for the better. So I think at sort of a young age, we looked at sort of positions that would foster all those passions and skills, and then we decided on speech therapy, not knowing that obviously in countries like the UK, you can work for the NHS, whereas in South Africa, you have to be a bit more creative, especially if you want to survive in the private sector, because a lot of our medical aids do not always cover these sessions unless you're on a very good medical aid plan. So it's a little bit more difficult to pursue the position in the private sector, which I've done for quite a couple of years, and I'm not looking back feeling that it was worthless. It actually taught me so much. And using the resources that we have to make the best of what we have.
Correct.
Yes. But yeah, I think I loved being a speech therapist. It's just sometimes you have to adapt to the way things change as well.
That's correct. Tell me, for someone who may not have any idea what speech therapy is, would you tell us on a day-to-day you are consulting, and I also believe you focused more on special needs. Now with speech therapy, what would be your day-to-day looking like? Because when you're saying speech, I'm imagining you are helping someone to deliver a speech at Parliament or it's as an MC or whatever. I mean, speech is just broad, but obviously from the biology or the medical sector, speech therapy means something very specific.
Yes.
And we want to deliver that simply also for the viewers. So what would you say speech therapy is, or how does your day-to-day look like as a speech therapist?
So speech, language, and hearing therapy is a B honors degree. And in America, they call it speech pathology, because anything that interferes or has an impact on a person's ability to communicate, whether it's their language, so, they've had a traumatic brain injury or they had a stroke and they can't access the language center in the brain, or whether it's actually a physical issue with the speech organ, and that involves the tongue, the lips, your breathing, everything that's got to do with the mechanism of speech. So we call that motor speech disorder. So it's the physical aspects, but also you have the language aspects, which are situated in the brain. So there's lots of things that can happen to a person that has an impact on this function. So a speech and language therapist is so wide, because you can work in the neurological side of things, so that's more acute, where you work in a hospital setting or a rehabilitation center where people had an injury or they had a stroke or it's near drowning or whatever it could have happened to the person, that they can't access the physiological and motor aspects of the speech function. So we are trained in diagnosing the problem and then creatively with the family find solutions of overcoming this problem, whether it would involve a sort of intermediate plan while the person is still recovering, for them to communicate via pictures, using digital age to point what they need, or whether it's for the family to find ways to communicate with the patient, for example, changing the questions to yes, no, for the patient to be able to communicate what they need, their immediate needs, meeting their immediate needs. And then also in the long run, what happens after their recovery? Where do they integrate back into workplaces, schools? And then, so it's very broad. Then you also just get the basic speech and language difficulties kids struggle with developmentally. So they may have a developmental delay starting in school. So teachers would detect this child is struggling to pronounce or produce certain speech sounds. So then it's about, working with the school in sort of remedial help, trying to sort out those small little things for the child to flourish in later years in school. So it's about school readiness, identifying early language errors, language problems, speech production problems. And then with special needs, it's a little bit more broad and complex, because these involve children that's got physical limitations, so that they are being integrated as best as possible into a special school where they can learn and flourish just like any other child with aids. So anything that can aid them into communicating and learning.
And you can measure their growth, or
Yes.
you can measure the
Yes.
change based on how quickly they come back to their normal motor skills or their ability to communicate.
And we use standardized tools for those type of things to measure. Yes, so we have all those equipment and different equipment to do that. And then with the swallowing difficulties, you can do a swallow assessment using different types of food consistencies to see where the person is coping, starting with maybe a liquid diet and moving them through the stages of challenges, making it a more coarse consistency, and challenging them at that way to overcome maybe sort of muscle weakness in the mouth or in the tongue or whatever. But we work closely with other professionals like dietitians, the doctors. It's a very sort of multidisciplinary environment. And that is what makes it difficult when you work in the private sector, because you work in isolation. You have to really make an effort to reach out to the other professionals, whereas in an acute facility as a hospital, everybody's there and they can work together.
That's very interesting. I also do know that you've worked in NGOs, clinics, and also you've worked in like locations. Particularly, you've worked in Kailicha, Site C, where you are even able to communicate with the residents and the kids in Xhosa.
Yes, baby.
What was that journey like? It's very interesting.
Oh, I loved it. Yeah, ndiyathetha kancinci sisi. So the children used to teach me all the animal names, because sometimes we have to look at their vocabulary and their ability to speak in their mother tongue. And for them to elicit language out of a child, you have to sort of introduce conversation. And I loved community work. It was one of my best times over the years. It's just to be challenged with the things that doesn't come naturally. I loved it, and I learned so much about people and what's important for people, family life, taking pride of your child, bringing them to a clinic, putting the best clothes on. They shine with all the Vaseline, and and you just see the mom's pride in her little one. And then receiving that sort of service of how to take care of your child with cerebral palsy and what you can do practically at home. Sometimes it's not fancy stuff. It's just how you position a baby when you feed them that can make them choke less, or whatever the situation. So it's a lot of practical work. And I see myself as a very practical person. At my workplace today as well, people laugh at me because they will often find me on the ground, trying to fix a chair or climbing under the desk and fixing wires or whatever. So with my dress.
You said you love camping.
Yes.
It's all the camping.
Yes. So I'm a very practical problem solver. So, and I think I get that from my dad because I used to be with him in his garage and watching him fix stuff.
Wonderful.
So yes, I love it, and I also love all the richness of South Africa and all our cultures and the different languages. I've always been interested in language as well.
Okay,
Yes.
that makes total sense. Thank you for sharing
Mhm.
that. I know it has been a beautiful path for you, and like in different seasons and different places and
Yes.
different people, just amazing. And then boom, you transitioned to dermatology.
Yes.
How? Like, help us connect the dots.
Yes.
How did you move from
Happen.
speech and language therapy to dermatology?
Okay.
What was that journey all about?
So, when COVID hit us, COVID-19, I was still trying to practice from the house as in the private sector. So that means,
As a speech and
yes,
language
yes. So
therapist.
that means dropping your kids off at school and then having sessions, home visits, visiting schools. So you're very much on the road, and it's also a business where you're very ad hoc. So you only get an income when you have clients and when you can work out there. But when COVID-19 hit us, there was a period of a year that we had our kids at home because the schools closed, and the schools did everything in their effort to continue with the curriculum, but it was very much parent-driven at home. So I was stuck at home with my kids, and not stuck in a bad way, but I always thought being a speech therapist, I was able to homeschool my kids, and I quickly found out it's not that easy. And I realized that in my profession, I'm not a person that can do online sessions. I'm very much a person that needs that physical interaction with a patient. So lots of people made a big success in doing online services, but I then decided to focus on my kids and getting them through that year academically. And it was difficult because I can't leave them at home. I can't visit. I can't go to schools. It was just difficult to continue. And I started thinking about, is there something else for me perhaps after this? When I start integrating back into schools, perhaps there's something I can do with my time, with my skill set that is in specific, boxed in a specific time of my day, but I can also be a mom to my kids and support them.
Right, yeah.
Because that is sometimes a tricky business, being the mother in the house, having to run your whole household and then manage that sort of business on the side. So I started thinking hard of what I should do, and lots of people said to me, "Oh, Annelize, you'll never be employed in a different business because you're overqualified as a speech therapist, and you're old, and people won't take you because they'll think you'll be bored in 2 weeks and you just move on again." And I got quite a lot of negative attitude about pursuing something different, going into a complete different field. But I didn't stop there. I started looking at administrative posts for the morning or something where I can use the skill set of empathy, loving to work with people, empowering people.
Servant leadership.
Yes, servant leadership, and also strong administrative skills, because that's something I am good with. I like order. I like setting my desk is always very much so.
Is it
I'm
just that, or is
structure.
it OCD?
It's OCD. It's OCD. But you can utilize OCD into something amazing, because not everybody does have that, and somebody needs somebody with OCD in order for their business to flourish. So it's so interesting. I think I would like to encourage people to never give up in thinking that this is the only thing that you can do.
Correct.
I'd still want to one day learn to use a sewing machine. That's something for the future, and I'm amped. I'm going to learn to sew. But I believe everybody can challenge themselves to do something different. And then this opportunity came up, and I remember in the interview I was asked, why would you want to do this job? Because you can be a speech therapist. And I said, well, I'm ready. I'm ready in my life to try something new, and just dive in and see what happens.
You see,
Yeah.
what you've just said is very critical and also very significant for these segments, because you will remember in my short introduction I said we also want to speak to professionals who have been in a certain field for long and they are wanting to try something else, something new, and now you're just literally an epitome of that, and showing that it's actually possible that you can try something totally different, not related to your field, and you can also apply your skill sets into that other field. Because I'm sure for many people, what first comes to mind, I don't have an experience for that particular post. I may not even know how to integrate my skills into that post. But then skills go beyond what you learned in school, practically, you know. You're talking about dealing with people. None of these, for example, your skills to communicate, empathy, is not a university course that you take to learn how to be empathetic, you know, how to be a servant leader. So it just shows that we have so much to offer in various fields out there. So I'm really going to anchor on this. I love that you mentioned it. I'm going to anchor on this, that don't be afraid to step into new and different fields altogether. You have the skill to offer into that field. So I like that you did mention that. Thank you very much. Now, for interest's sake, in simple terms, this is the second last question. What is dermatology? And perhaps take us through a few things that we may know and learn about skin cancer.
So when I started in this field as the receptionist, I didn't know a lot about this field. I had to learn what the different types of skin diseases entails, and also skin cancer. Because dermatology also is a wide sort of broad spectrum. You can go into different specialities within that speciality.
Like what?
Yes. So to be a dermatologist, you obviously have to have a medical degree first.
Medical degree, okay.
And then you specialize into the field of skin disease, skin diseases, and with the doctors that I work for, they have a special interest and skill set within skin cancer, and it's so interesting because you work with so many different skin diseases. It really opened up a complete new world for me. Whereas you think, people just go to a dermatologist for a rash or because they have acne, but there's so much more. And I think it's also important to know that it's specialist care, because it involves specialist equipment. The equipment that they use, it's all specialized. And I was so inspired by the dedication of Dr. De Wet's work, and also that he's dedicated his life to fight this fight against skin cancer. It's not just about the diagnosis of it, but also Mohs surgery, which involves a precision technique of removing skin cancer completely. So it's got the highest cure rate of curing skin cancer. So skin cancer is basically cells in the skin that becomes cancerous due to exposure to sun, UV radiation. And that's basically what we do. We diagnose and detect it, and then we have a very specific method of removing it. It's called Mohs surgery, and you can read a little bit more about that on the website. But there's not a lot of doctors in South Africa that uses this technique. So we do get referrals from all over the country by other dermatologists who feels that they would love their patients to have this gold standard treatment to get rid of skin cancer completely. Because unfortunately, skin cancer tends to reoccur if it's not managed and removed.
So it can be totally
Yes.
cured.
So there's different types. You get the superficial type of skin cancers, but then you also get the very dangerous ones that could spread.
What would be the superficial ones?
So that's the SCC. It's called squamous cell carcinomas and the basal cell carcinomas. So they're just still in this on the top skin layers of the skin.
More on the surface.
Yes, more on the surface. Yes.
Okay.
And there's different options for treating that, but that's more sort of something for the doctors to talk about. But then you get the more dangerous ones like the melanoma that you need to take care of very quickly. Yes, so it's wonderful to be in an environment surrounded by these dynamic people who have a passion for what they do, because that also drives us as the administrative staff to provide the best service, because you can see how it impacts people's lives. And unfortunately, we live in a country, South Africa, that's warm and nice, so people spend quite a lot of time outside in the sun. So it tends to be more in the warmer countries that we see this.
Okay,
Yes.
so the UV radiation, exposure to sun, that's the key thing that causes skin cancer.
Yes.
Nothing else.
Yeah, so I won't go into too much of the other things, but that's the number one reason for yes,
would you also say,
UV radiation.
Just for interest's sake, but like you said, we don't have to go into details. Would you also say like products, like skin products?
No. It's UV radiation. Yes, exposure.
Okay.
Yeah.
Now, I learned something when I visited your office one time, and you shared, I'll paraphrase, but you can bring it well in context now, that actually it's more light-skinned or white people that get more skin cancer than black people because of melanin. I need to hear about that. You need to hear about that. So
yes.
what's that? Well,
so,
tell us about that.
But you can just see in the colder countries, most people, where they come from, they're fair. And in Africa, where it's hot and there's lots of sun, people have darker skin. So I think you're just more protected when you have darker skin.
So melanin is protective.
Yeah. So it's a protective barrier on your skin. Yes.
What? I think that's so cool. You even showed me on your, I don't know what to call it, but where you have all these drawings, and you showed me where that layer is at. It's just, guys, so some of you are blessed. Some of you are blessed. Now, you almost kind of scared me a bit when you spoke about UV radiation, and some of us would like to do nails. We use UV light to dry the gel and stuff. And now I'm thinking, could that be like dangerous? But I'm kind of shying towards, but I have melanin.
No. You know what? I think it's difficult to go into all that medical and the causes of it. I think some people can be in a predisposition, unfortunately, because of also a family history. There's lots of causes. Okay. But I think it's more sort of the UV radiation from sunlight.
From sun. Okay, guys, we're safe. Thank you so much. Okay, I think my last question would be, for someone who wants to pursue a course or a career into language and speech therapy and or even dermatology, like what would you say to them?
I think before you start with your career set, I think it's very important to do some research about where you stay. Where do you stay? What type of jobs are in need in this country? You know, to be part of sort of the game changers, the solution in our country, and not just pick a lovely course that you think, oh, this seems nice. I think it's I think it's important to do some research about where you're based, what's happening, what's needed, and then look at your skill set, your personality, your skills, your gifts. And for speech therapy, there's lots of very successful speech therapists. I know them. They stay in Somerset West. They have wonderful practices, and they're really flourishing. Um, I think it's very important to go and visit them and ask them, can I sit with you in a few sessions? Can I see what it's all about? Can I see what the cost involves in setting up a private practice in South Africa? Or what would it be like in working in a government position, which is also wonderful. There's lots of wonderful government facilities. But again, those positions are limited. So with the amount of people graduating, you have to sort of look at, what's available. And people that goes for those positions, they tend to sit out until they retire because it's limited. And then for dermatologists, I've seen that there's not a lot of them. So it's a field that's quite difficult to get into. And also the setup of the practice can be expensive because your equipment is expensive, and it's also expensive to get all the consumables, and the cost of, for example, your medical supplies it's even just your instruments. It's costly to set something up like that. So I think you have to do the research and be sure that this is what you love doing, and then also surround yourself with people that's positive and who wants to journey with you with the same goals and vision. I think that's very important.
Okay, I like the
Yeah.
angle that you're taking, whereby you're not just saying, "Oh, guys, go for it."
Yes.
I like that you're saying, "Do your research." Very important. Check what are the needs around where you are, because you can choose to do any course and then not have a job afterwards, or not even have any
Opportunities.
relevant contribution because it's not necessarily the primary need where you are. So do your research, check your surroundings. I also like that you're saying check your skill sets. Your skill sets, you spoke a lot about your love for community, empathy, and all of that. So, for example, I think I can already assume you can't be a speech therapist if you're not empathetic, if you're not patient. I mean, imagine trying to teach, help someone regain their capacity to speak. that can be frustrating, I can imagine. That's frustrating just talking to a toddler who can speak, but obviously just a little younger. Now imagine the same toddler who has had a traumatic experience. Now, I mean, it's just double the problem. So check your skill set. And I also like the last one where you say, surround yourselves with people who are in those fields. So that's very key. And thank you so much. Thank you for sharing that. Thank you.
I think I'd love to leave you with this thing that really motivated me in difficult times, and when I think I didn't have the skills or what it takes to do this job. There's a guy called Jordan Peterson, a psychologist, who said, it's good to have a problem worth solving, because that's what gets you out of bed in the morning.
Okay. It's good to have a problem worth solving, because that's what gets you out of bed in the morning. I like that. The previous guest was me, so her last words were, the best skill you can have as a teacher, she's a master of education, the best skill you can have as a teacher is a teachable spirit. So I'm loving these little nuggets at the end of the segment. Thank you very much. I've learned a lot. I came here with an intention of like, I want to know this dermatology. I want to know this skin cancer stuff. I want to know this speech and language therapy stuff. So I hope you learned a lot. And thank you so much once again for your time, availing yourself and honoring this invitation. I think time flew by.
Inkosi kakhulu, Sisi.
Enkosi siyabulela, Sisi. Okay, guys, that's it from my side. Thank you so much for watching once again. Thank you for your time. And please do join us again for the last segment. We'll be talking to Hoition Mafura, and she is a digital marketing specialist in the field of public relations. And you want to know more about that. Thank you once again. See you next time.
So when you're told you're not good enough, you tell them, not only am I good enough, I'm more than enough.